Welcome. It's been a little while since I've been able to get on video like this. It's been a little while since I've actually done my hair and done some makeup. So that's where the delay's been. But I want to talk to you today for just 5 minutes and explain to you the two most important lab markers that you need to know and why. It could be the missing health piece to your puzzle. So if you have blood work, go grab it. If you don't have blood work, take notes so that when you get blood work or when you can go get access to your blood work, you can see this. Okay, now the two markers are going to be found inside the CBC with differential. Now, this is my lab test worth the price of gold if you know how to read it correctly. You must have the differential portion with that CBC. Most of the time, physicians order it. Sometimes they don't, and I just check the right box, please. So at the very top of this lab marker, this lab, you're going to see a marker called the white blood cell count. Okay, when you see the white blood cell count or the WBC, you know you're in the right spot. You're going to scroll all the way down until you see the word neutrophils. This might also be called granulocytes. And then right below it, you're going to want to know the word lymphocytes. Those are the two most important markers that you need to know in all of your blood work. Okay. Why? The neutrophils, these guys, they tackle bacterial infections. That's their main job. Okay. Lymphocytes, they tackle viral infections. That's their main job. The magic number for the neutrophils is 60%. Make sure it's the percentage form, not the absolute value form. We want the percentage. That's what does the math easily. Okay, if it's less than 60%, it's probably a good thing. If it's greater than 60%, we got a problem. Your body's fighting some bacterial infections. Okay, now this can look like literally, I had a patient with a 88% neutrophil count and she had frozen shoulder syndrome, meaning she couldn't use her shoulder and all treatment into her shoulder failed. I tackled the bacterial infections with some supplements, shoulder's just fine. Her mood is fat balanced. I mean, there's so much more than just her shoulder. Okay. Bacterial infections often lead to joint pain and gut problems. Gut problems like IBS, IBD, Crohn's, ulcerative colitis, or I have gut problems and nobody can tell me what's causing it. Here they are. Okay. Viral infections, the magic number for lymphocytes is 30%. If it's above 30%, your body's fighting some type of viral infection. I don't care what it is. Use an antiviral, support the immune system. This is the most common cause of chronic fatigue. If you're battling chronic fatigue, you're not going crazy. It's not because you need an antidepressant or an anti-anxiety pill or have chronic fatigue syndrome, whatever the crap they want to call it. It's because your body's fighting a low-grade viral infection and it doesn't have energy for anything else. It's also the number one cause of autoimmune diseases, the number one cause of anxiety and depression. Okay, now these two are the most important markers, not only for this reason, but for this other reason. Pay very close attention. The magic number for neutrophils is 60%. The magic number for lymphocytes is 30%. That is a 2-to-1 ratio, which is a good thing. We want that. What happens when they start to meet in the middle? Now we're getting a 1-to-1 ratio. And that changes the game because now we're fighting autoimmune. And that's a wrap. Learn more on the podcast, Beyond the Diagnosis with Dr. Kylie. Learn more inside my book on Amazon, Why Are My Labs Normal? And if you're a practitioner, stay tuned because we have the upgraded 90-day functional bloodwork specialist program coming up. We start in April. Deadline to join is March 30th. You're going to hear a lot more about it, including a 3-hour intensive coming up on March 31st that should be costing $97, but it's a lucky Irish month, so it's going to be free. I know I shouldn't do that anymore. I really shouldn't. If you're a patient, we got a luck of the Irish sale for you too. So stay tuned. Details are coming out on Monday, March 6th. And let's use your blood work to change your health. And let's use a blood work your patients already have to change your practice. See you soon.